Welcome to Today with Dr. J, where I give you the guidance and tools to figure out what works for you in your recovery.
All right, everybody, welcome back to the conversation part of today's podcast. I'm here with Maiasz, an author in the space of addiction who's been writing for decades on this topic. So, Maia's books and her thinking are some of the things that I read early on when I even got exposed to the idea that harm reduction was a thing back when Maia first found out about you and Stanton Peele and Andrew Tatarski and all these people who paved the road. So welcome, first of all.
Thank you for having me.
Yeah, absolutely. So, we've connected a whole slew of times in the past. And one of the topics that we've really connected on over and over and over is this idea of abstinence only versus harm reduction as a concept, even in addiction language and addiction in the conversation around addiction. So your latest book, Undoing Drugs, is primarily about this, about the harm reduction concept. So why don't you walk people through maybe what got you to writing this book and what the point of writing this specific book about harm reduction was for you?
Sure. So harm reduction is basically the idea in drug policy that we should focus on stopping people from getting hurt rather than stopping them from getting high. And so this grew originally in the AIDS crisis. And the book documents some of the people who brought this idea to the world in the drug space, basically. And I mean, obviously, you could go back to Hippocrates for ideas about reducing harm. But in the drugs field, traditionally, the idea has been the way to reduce harm is just stop people using drugs. And that is never going to happen. Certainly, there's plenty of people who will quit, but there has never been a drug-free society. And frankly, harm reduction says, and I believe that most people care more whether there's harm going on, as opposed to, oh my God, someone's getting unearned euphoria. Isn't that terrible? I don't really care. It's not my business. If I'm the government, it's really not my business. What my business is, if I'm going to be concerned about you, is, are you getting hurt or are you hurting other people? If not, right, I should have, I might like you as a friend or whatever the whole thing may be, but as a policymaker, I have no interest in dealing with it because there is no problem.
Well, I want to stop you right there because there's a couple of things you already mentioned that I think they sound natural to us, Maia, but I don't think they're that natural to a lot of people having this conversation. So you said that the idea is to reduce harm, but that a lot of people have connected reducing harm with stopping to use drugs. So let's start there, right? I mean, I know I wrote this book called The Abstinence Myth, and this was a central theme to that book. So I want to start there, and then we can move to the other piece,
sure,
which is, should we even care that people are using drugs? But this idea that if people are using drugs and they have problems with them, that the most direct route to stopping the problems is to stop the drugs, I think it is the standard way of understanding addiction in the minds of the vast majority of people who've ever dealt with it. And I have a question for you. In the abstinence myth, I talk about two ways that comes up. First of all, people are made to commit to quitting if we're going to offer them help.
Right.
And the second piece is that once somebody starts getting help in whatever way they do, the way we measure how they're doing is by measuring how long they've been abstinent. So those are two different ways that seem ridiculous to me.
Yeah, it is ridiculous because what we should care about is, how is this person doing? Are they alive? First of all, what's their quality of life? Are they able to connect with people and have meaningful work? And that's what we care about for ourselves. So why shouldn't that be what we care about for people who use drugs? Oof. We have had this idea, and one of the reasons I called my book Undoing Drugs, that there are these things called drugs, and they don't include alcohol or tobacco or caffeine, and they're bad. And
or Oxycontin, or until recently, Oxycontin or Vicodin or Percocet.
Right, but let me finish. So the idea is that these substances are the problem, and that if we just take away the substance, we will fix everything. And that people are causing this problem for themselves because they're just too hedonistic. Now, the reality is that most drug use is not addiction and is not harmful. And we recognize this when we, sell alcohol all over the place, although there's plenty of harmful alcohol use. So, undoing drugs means trying to recognize that the concept is problematic. When you are saying LSD is the same as alcohol, is the same as heroin, that is really not true. Two of those things are way more addictive than the other one. But that other one can also have harms, but sure, they're very different harms. You're not going to overdose on it, but some people may have some pretty severe psychiatric reactions to it. So on the other hand, it may be useful in the treatment of certain psychiatric conditions. So yeah, but a really good example of the problem with seeing the drug as the problem is our horrible response to the way the opioid crisis, as it is called, has occurred. Because basically we thought, oh my God, these doctors are overprescribing. They're not doing it for any reason. They're just overprescribing because they want to make money. And because the drug companies told them to. And then, okay, well, we'll just cut it off. Okay, so 2011, we have cut the medical opioid supply in half. We have more than doubled the overdose death rate. We have harmed millions of people in chronic pain by taking away medication that was actually working for them. And we've pushed some of them to suicide or to overdose. And why we ever thought that, well, you just take away the substance, nobody's, that'll cure the addiction right there. Nobody's going to go looking on the street. They're just going to it was the stupidest policy ever. And we could see going in that this was a terrible idea. You could have, let's say you want to bust a pill mill. Okay, great. You have a list of all the patients. Do something for them. We never do this. And it's and then we're surprised when there's gangsters outside ready to provide for them when we don't, no other doctor will see them because, oh, the last guy who prescribed for you got arrested. So, it's a very ridiculous way of looking at things. Drugs are tools just like anything else, and people use them for various things. Now, just like if you use the wrong tool in, carpentry, it's not going to work very well, or it could actually make things worse. Similarly, substance use can end up doing harm. Yeah. If you're trying to treat depression, there are better, safer drugs for most people, although actually for some people, opioids do work to treat depression. But leaving that aside for the moment, compulsive drug use, despite negative consequences, is not a good way to treat your depression. And compulsive drug use, despite negative consequences, is the definition of addiction.
Yeah. Oof. Again, so much. And I knew we'd have so much because your knowledge of this is so deep. But you talked about the relative addictive potential of different drugs and how they're obviously not classified based on that in their medical use, or alcohol would be somewhere. So alcohol would be scheduled somewhere, given the fact that up until the recent fentanyl epidemic, it was killing far more people than opioids. Right?
I think it actually still does.
Yeah, but they're getting close at least. Whereas I remember when I started writing about,
alcohol is 200,000 a year, and opioids are around 100.
Yeah, so I remember when I started writing about this, in 2008, and the numbers were, it was 140 dying from alcohol and 20 from opioids. And I said, why is everybody paying attention to opioids? Well, opioids have caught up a bit, but
well, and also to be fair, alcohol tends, not always, but tends to kill people older.
Yeah, older, and oftentimes still in combination, which is another whole thing we can get into. But so again, a ton of stuff to talk about. But one of the things you said, and again, Abstinence Myth book and some of your past work talk about this already. But let's start measuring how people are doing in their life, let alone in recovery. using the same ways we measure how we're doing in life. And I'm pointing at myself, but I used to be addicted to meth. So some people would say that's not the way I should measure how I'm doing with life either. But the idea that if you've got friends and family, if you're doing something meaningful that pays your mortgage and your food, and if you're kind of happy about some of the stuff that's happening in your life and you're struggling in some other ways, but it's getting better all the time, right? And your health is managed or getting better and you're working on it. Like if that's going on, then your recovery is going well. Yeah. Even if you haven't abstained, you're just reducing, or even if you haven't reduced and you're still keeping it. So that's number one. And I think that's really, really big. You talked about how all drugs can be abused. And this is the thing that I think, so my background is actually in behavioral neuroscience and psychology. Like when I was at UCLA getting my PhD, I thought I was going to go study the genetic markers and the receptors and the super detailed biological underpinnings of addiction, because the NIDA model was really heavily pushed when I was at UCLA. So I didn't even know these other areas of research existed, if I'm honest. And it took me my own work and finding Stanton, finding you, finding a lot of other people to go look in other areas. And it is also true, though, that the drugs can cause dependence and other issues related to the biochemistry of them. And you talked about alcohol, and I always find this pretty amazing that nobody knows this. And I think if we map this out, the exact same thing will happen for opioids. Over 90% of alcohol sales are limited to about 5 to 10% of alcohol users, drinkers. And the reason I think that's an important thing for us to talk about is you were saying most alcohol use doesn't result in harm. And that's because the vast majority of people actually don't really drink all that much. So they drink here and there, whatever. And then there's this small group of people that ends up overusing. Now, unfortunately, historically, the narrative, and I want to hear how you talk about this in your drug, because I know you talk about marginalized groups and things of that nature. The narrative, and this is the dumb, we're all individuals who can pick ourselves up by our bootstrap kind of American narrative, is that, well, those 5 to 10% of people who just can't handle alcohol like the rest of us can, they're dumb or unmotivated or in some other ways defective, and that's why their addiction is taking over their lives. We should just kind of do away with them because they don't really matter. And I think that's why the us versus them narrative, we're normal people over here, but they're addicts and alcoholics, and we'll put them in the other box, makes sense for a lot of people, right? Alcohol is a very well incorporated and understood and accepted part of everyday American life. Yeah. 70% of people who come to IGNTD come to us for alcohol, and they will tell you this over and over. The biggest problem about stopping alcohol is not stopping alcohol. It's the fact that everywhere else in life, alcohol is an accepted part of things. So you feel like you can't go to social events. You get offered it at weddings, business meetings, et cetera, et cetera. Now, that's changing a tiny bit with the Sober Curious movement, but not really. And other substances are coming in to replace it. Anyway, so how do you see that group? How do you see the 5 to 10% group that does seem to develop problems with drugs and alcohol that is different than that common narrative, which is there's something broken in them?
Well, I mean, I wouldn't say all is well, but I would say that generally the problem is something that happened in their life long before they ever picked up a drug or alcohol or another drug. And so, generally people with addiction have outlying temperaments, and these can be very, very different from each other. Somebody might be really anxious, or somebody might be really impulsive, or somebody might be really bold, or somebody might be really shy, but it's all like outlined, like you feel different from everybody else. And a lot of that is genetic, like our temperaments are just different from day one. And there's nothing wrong with, different temperaments suit you to doing different things, but they can increase your risk for addiction. So the other big piece is child trauma and adverse childhood experience. We know that the more and the longer it lasts for, the more adverse experience you have, the higher your risk. And then the third element is sort of economic despair and feeling like there's no future. And so there's virtually no one with addiction that doesn't have one of those three factors. And typically they have 2 out of 3 or all 3. And so this is why it's really complicated, because if you just assume, well, everybody's taking drugs because they're bad, we can just break them down, create a new personality for them, and then that will solve the problem. The problem is that that does not work, because people are taking drugs for reasons that make sense to them, and they may end up doing it in a very unhealthy way. But in some instances, those drugs allowed them to survive a very messed up situation. And, our psychiatric treatment in this country, our mental health system is just awful. And it's not surprising that people try to self-medicate in varied ways. It's so much easier to call your dealer than it is to get your insurance to approve your whatever's. So it's just not surprising. And we have this idea that people with addiction are uniquely weak or something like this, but all of us use drugs. Most of us are physically dependent on caffeine, for one. You get a headache because you didn't have your morning coffee. Right. That is something like 50% of the adult population. Probably 80% drink at least sometimes. People are always, lots of people smoke weed. There are many, many substances that we use in the course of a typical day.
Sugar, these things,
right. Yeah. And it's just but people sort of have this thing where the substance goes in your body and the substance is changing you. And the reality is that that doesn't happen unless these other things are going on.
Yeah.
Because, if we'd all be completely hooked on our phones and we'd all be unable to put them down if it were as mechanistic as the way some people describe addiction as being. Sure. You look at these things, oh, look, they're trying to hook you with this intermittent reinforcement and these gambling things and whatever. Well, 1% of the population has a gambling problem. We have gambling things everywhere. Yeah. There's something different about that 1%. I am not saying it's bad.
Yeah. Well, and the thing, and the factors you mentioned. So you mentioned biology, and here's the thing where all these things mix, and that's why it's so hard for people to get a clear understanding. Right? Genetics are the blueprint, but then there's epigenetics, which is the way that your biology interacts with your experience and your environment. So you talked about trauma, temperament, and economics, or somebody's environment that they grew up in, and those things all interact. And the reason, and I love that you put them so succinctly together, of course, but you can put somebody in rehab for 30 days and do really amazing things with them. You can go to groups for 6 months or a year. We're battling against this confluence of factors, some of which for these people go back 20, 30, 40 years. And as a lot of groundbreaking trauma work has shown now, and the work on social determinants and socioeconomic status and all that stuff that has been there for decades and decades and decades, you're not going to resolve somebody's perspective on the world or the way that they see life, both biologically and because of the way that they grew up, in 30, 60, 90, 120 days. You're fighting large forces that have formed who this person is. And we call our program the Hero Program, by the way, because as you mentioned, I see people over and over who I say to myself, oh my God, you've adapted in some of the only ways that allowed you to make it out of this hellhole that you started at. And the fact that you're even here right now is a pretty huge success. So looking at them as damaged is negating all the incredible work they had to do to even survive sometimes.
No, I think that's true. On the other hand, looking at people as completely, totally fine who just experienced a drug and then became a zombie is also problematic. So you have to look at both sides of that coin, I think.
Yeah, 100%. Okay. Now, knowing you and knowing the work that you've done in writing this book, a lot of what you do always is proposing some alternative ways for us to move forward, right? Because pointing out the problem is one thing, talking about potential ways to pull us out of it is something different. So with everything you've done and everything, again, decades of looking at this problem from 15 different angles, What are, if you had to kind of succinctly talk about, I don't want to give you a number because I want to leave it up to you, but if you had to give us a short list of here are the things we need to do to move forward to change the way this presents, helping both society and the people who are struggling, what are your top recommendations?
I mean, so this is fundamentally, the idea is do harm reduction, which is focus on harm. Don't focus on trying to stop people from using substances. And when you take that perspective, you suddenly have to look at the harm we're doing by trying to stop people from using, locking them up, all the gangsters in the market. All of these things are harms that come from our policy. And if you continue having bad policy that's continuing to do harm, you can sort of clean up a little bit at the end, but it is a lot better to stop hurting people in the first place. And so, I would argue that our policy needs to be fundamentally based on harm reduction. I mean, I'm very glad to see that the Biden administration has embraced at least parts of the idea. But if you really take that idea on, you can't criminalize possession at the very least. Nobody has a good argument for locking people up for drug possession. Even people who support doing that now say, well, we should do that so we can get them into treatment. What they don't understand about that is that that isn't what happens when people get arrested. Jail is a terrible place to treat people. And if we really believe addiction is a medical problem, why aren't we arresting, diabetics for eating donuts? Like, this is such a fabulous way of, dealing with health problems. Of course, it's not. It's stupid. And if, the whole thing of the drug war is use harsh consequences to send the right message. And the whole thing of harm reduction is that, no, if we want people to do better, we have to treat them better. And we have to behave empathetically, understand why they're doing what they're doing, and give them the resources to do better, or allow them to be able to get the resources to do better. So, it's just like, it's kind of very silly, but it's just like, how about being nice to people before you're cruel to them? How about attracting people into getting help before you try to coerce them? We have these ridiculous things where it's like, well, okay, there's like homeless people with mental illness on our street. So let's force them into treatment. We'll get the cops to put them in the hospital, and the hospitals will put them in treatment. Well, first of all, we have no beds for them. So you're forcing them into non-existent treatment. Second of all, when all of your treatment is based on coercion, you get really lousy, cruel, carceral kinds of treatment. And so, because it's kind of basic capitalism, if you don't have to attract your customers, and your customer is really the police, it's not the person who's coming to you with a problem, it's the government, then they don't have to care about the patients at all. It's just like, and the outcomes are not, if a patient who's coerced into treatment fails treatment, they go to jail, not the counselor. It's not the counselor who's going to jail because the treatment didn't work. So, if we actually make addiction, if we actually take harm reduction on board, this means overhauling the entire treatment system to make it customer friendly, and to make it so that it is easier to call your counselor than it is to get your dealer on the phone, or whatever, at least almost as easy, Also, dealers often make you wait. So but yeah, the fundamental things is get the criminal justice system out of this form of healthcare. And that means eliminate the DEA. The DEA should not have any control over medicine. That means addiction medicine. That means pain medicine. That should all be on the FDA. Yeah. There is absolutely no reason to have cops determining, oh, your dose is too high. They don't know what they're talking about. And
definitely not medical professionals.
Yeah. And it's just why should they have any, the thing is okay, let us argue that the DEA had prevented this opioid crisis by not allowing the medical supply to double. Maybe then we could have a talk about them being a useful agency. Even the supply that they literally have 100% control of, they couldn't deal with. So why are we expecting them to deal with a supply that they have zero control of? This is not the way to do this.
Yeah.
Now, there are all manner of complexities when we're talking about regulating currently illegal drugs. Like, you really don't want, Philip Morris fentanyl ads on every corner. This would not be a very good way of, I believe that our current system of prohibition is like the worst possible, but the second worst would be a completely commercialized free-for-all. And a lot of people are worried about that with marijuana. I'm a little less worried about that with marijuana than I am for other substances, simply because it is so much less harmful than the things that it might substitute for.
Sure.
I still don't think commercialization is good, but this is what we've decided to do. But I think, I'm actually writing right now for the Times about the Controlled Substances Act and how dumb it is, and how it really needs to be overhauled to actually make sense of things, because it's just not the case that for all of human history going forward, the only recreational drugs humans are ever going to do are alcohol, tobacco, and caffeine. That's just not what's going to happen. So we can either choose to have gangsters introduce new products with no testing, or we can figure out ways of getting safer ways to people. And this is complicated and difficult. And I do not want to see pharma marketing, here's the latest lifestyle high, guys. That would be bad too. But it would be better than having gangsters overrun certain countries. It would be better than locking people up. But it still would be terrible. So what you really want to do is think of ways of dealing with the substances that exist, do computer modeling of markets, understand what substitutes and what complements, figure out precisely the harms that we're worried about with this substance and how to mitigate them. And so this is not easy stuff. It's not like you say, okay, we'll just legalize tomorrow and it'll fix everything. That's ridiculous. But certainly the place to start is decriminalizing possession, because we know that does harm and does no good. Yeah.
So, I like that you point out that this is a complex question. And, if we're honest, we don't like complexity, right? We always want to distill things down to yes, no, 2 categories. If you have to make it 3, then that's fine. I'll take 3 categories. So maybe totally normal, struggling, and full-on alcoholic addict. It's in people's heads. It makes it hard to have nuance, which is actually part of the reason why this conversation has always been so difficult, is because I think people want to make it simple. So in the past, it's been like you said, alcohol, nicotine, etc. I see people do them, and I know that they're fine because I use them and they're not that big a deal. So those are okay, but not if you drink too much. Then you're in this other category called alcoholic. And let me tell you how much too much is, right? Let's figure that out. But all the other drugs that the government has scheduled, if you touch any of those, then you obviously are a drug addict and you have a problem, and you're a criminal and you're going to go to jail. So people really, really try to oversimplify every equation. I do wonder what market forces will do as we go along. I try to look at it in the following way, right? We've known now for a long time that burning coal hurts our environment, that polluting, that throwing random fucking garbage in. Sorry, listeners, if you are with a child, I should put a warning. If you just throw your garbage out the window of the car that you drive at, our world is going to be a nightmare moving forward. But we haven't outlawed food containers and bottles for that. We've created penalties for doing the wrong
Not all
thing.
that well. We really need to do better on that. But yes.
I know. But we've done what we can to control the way people then dispose of or interact with those things post-consumption. And I see something similar with the drug piece. I think it's ridiculous in some way that the government has decided that its job is to intervene with what I put in my body anyway.
Yeah.
Right. That's an interesting discussion to have. But the way that it's been circumvented, and you talk about possession, is it's actually not illegal to use drugs. It's just illegal to have them or to sell them. So that's the way they've gotten around that question. But in reality, it gets back to controlling what people do. And so I think you talked about this. I never even got to it, but I'll just mention it. It was the second point you brought up at the beginning that I wanted to get to, which was, should our goal even be to get people to stop using stuff? Or should it be for government and whatever agencies we decide within it are responsible here and have a role to help make people's lives better and support people in their actual choices? And I don't think most people would even know right off the bat what their answer would be on that, right? Because we go back to puritanical values that are espoused in so many aspects of what America is. And even though, 50 to 60% of Americans use mind-altering substances, and I'm not talking about nicotine and caffeine, and not even alcohol, I'm talking about the other drugs, or when you include cannabis in it and include all of them. So even though most people use something, if you ask them outright, they would say, "Oh no, drugs are bad for you, and people shouldn't use drugs." So we're gonna have to resolve. It's almost like the sex conversation, but that's very different. And then we're gonna have to resolve these inner value conflicts that we have as people and as a society. But I think the biggest thing that I heard in your solution is we have to put some actual thought into these answers and not just throw the baby out with the bathwater, or decide that some black or white version of this will end up creating the final true answer that can be useful in this situation.
Yeah, no. And I mean, I also think that when you're talking about like the question of abstinence, this really has to be an individual decision, because there's definitely people that find that, for example, it's a heck of a lot easier to not drink at all than it is to moderate. It's just a pain in the butt to moderate for some people, because you have to be constantly, okay, now can I have one, or now can I have one, or, it takes more work than simply, okay, I'm never going to do it, because you have to make more decisions, and that makes more, work for your brain.
Sure. That doesn't. I say that to people all the time, by the way.
Right. So but right. I mean, but it's just like the reality, like it's, if it's worth it to you, and if it's not a real pain in the butt to moderate, then great. But if it's just like taking up massive amounts of mental energy, it may just be easier to abstain. And so that's not a moral judgment. That's just like about like, I'm going to like minimize the things that I have to obsess about.
Yeah. Right. Yeah. So I was hoping, but we're probably not going to actually solve this problem on this specific podcast episode. But thank you so much for joining us. Always love your insight on these issues. They are complex. I've never found a way to really make them simple, unfortunately, which would be easier for people to swallow. You said you're working on the Times right now. Where can people find your work? Obviously, the book is available on Amazon, the stores, and all that other stuff. And so the book was Undoing Drugs. And what's coming up for you now? What are you working on that you're excited about right now?
Sure. So I am a contributing opinion writer for the Times now, which I'm really excited about, and that just got renewed. So I'm really trying to work hard on that, so that obviously it has a huge audience and reaches influential people. So I'm just trying to make my writing as persuasive and good as possible for that. And at some point I shall start on my next book, but right now just mainly doing that, and sort of various other freelance work and speaking.
Love it. Where are you speaking in the near future?
It's interesting because like I don't have stuff till like the spring. It was like I had the craziest November and October. I was literally, let's see if I can remember this. I went to San Juan, Puerto Rico, Memphis, LA, New Haven, Denver, and I'm leaving somewhere out. But like it was just like one thing after another. And I was like, yeah, I was just constantly that I don't understand why that happened that way, but I guess it was partially because like a lot of stuff hadn't happened in person for a long time. But you know, and hopefully it won't sort of clump up like that again.
Yeah. That's a lot of travel.
Yeah, that was just like, whoa. But you know, for the most part, I usually do like 1 or 2 a month, and it just sort of varies on, you know, what comes in. I'm speaking online to some people in Vermont, I think either this week or next week.
Got it. Awesome. Well, we'll put any links to anything that you're doing in the near future, and obviously a link to the book.
Yeah, and you could also just put my main website is just maiasz.com. So it's MAIASZ.com, and that's where you will find all my writing, which can be scattered in a lot of places.
Yeah. And thank you so much. You know, at Ignited, what we're trying to do is really reduce a lot of those barriers. So you talked about not having beds and not giving people access and things being expensive or hard to get to. And then most of them still being dogmatic and, you know, abstinence based, or not even about the abstinence based, but puritanical and shaming and stigmatizing. And our job is really to try to open that conversation up. So I love that that's some of what you talked about as being a solution. I have no impact on policy, so I can't do anything about that at all. But, you know, we try to work with what happens when people get to the other side. We're doing some really cool work with drug treatment courts and DWI courts. And I've actually been incredibly impressed. You find the right judge, and they are actually very invested in getting the people in their court better access, because there's waiting lists and transportation issues and all this stuff. You get a DUI, and anybody listening can shame anyone who got a DUI all you want, but some of them, okay, they screwed up. They want to get on with their lives, but now they have no transportations. They got to get to these meetings. They have real limitations on access. The right judge, I've seen it over and over. They just want to get people easy access to almost like be able to support the people who really want help while being able to screen out the people who haven't. So I think there are really good players in this space. We just have to find more of them and make those voices loud. So thank you for being one of those voices, Maya. Thank you for your recent book and being here with us today. Everybody, please go check out Maya's incredible books. This is number what for you?
8.
This is, damn, I'm on number 2 and I have no idea how that's going to happen. So thank you so much for all that amazing work. Thank you for being on here today. And everybody, go check her stuff out. We'll see you soon. Bye.